Hello, I'm Dr. Swathi Baliga, Paediatric Ophthalmologist at the Eye Foundation, Coimbatore, and today I would like to talk to you about childhood myopia. Myopia, in other terms, is near-sightedness, where a person can focus quite clearly on the objects that are closer, but has difficulty in bringing to focus objects that are at a distance. Right now, we are at the start of a myopic pandemic, which means that as the years go on, the prevalence of myopia is going to keep on increasing, and it is estimated that by 2050, every alternate person is going to be short-sighted. Even in our country, the incidence of myopia is rising rapidly. About 20 years ago, only around 2 to 3% of the children in the urban population were myopic. These days, we notice that almost 1 in every 5 children is short-sighted. So with myopia, our only concern is not that the child depends on glasses to see clearly. Apart from this, we have other concerns because as the amount or the magnitude of the myopia keeps rising, other risk factors to the health of the eye also keep rising. People who are more myopic also tend to have higher incidences of raised pressure in the eye, that is glaucoma. They may develop cataracts, that is opacities in the lenses at a younger age, and sometimes they may develop serious disorders of the nerve tissue inside the eye, what we call the retina, such as retinal degenerations or detachments. For all this multitude of reasons, we always try to keep the myopia as low as possible. So how does a child become myopic? All children, when they are born, have smaller eyeballs than the adult. When we check their refraction, it tends to be a plus power. As the child keeps growing, their eye also grows with them. Somewhere between the ages of 4 and 7, the number or the refraction of the eye tends to be towards 0. Sometimes there is a rapid growth or an overshoot, which results in a longer or a larger eyeball than average, which then requires a minus power spectacle to bring the light to focus on the nerve layer, what we call the myopia. Myopia from the point of diagnosis until the growth period of the child ends, that is the late teens, definitely tends to progress. During the growing years of the child, it is important to inculcate habits and lifestyle modifications which will prevent myopia from developing, and once myopia has crept in, these lifestyle modifications also help to prevent the rapid progression. So what are these simple steps? The first one is encourage your child to be outdoors and play outdoors for at least 2 hours a day. Sunlight has found to have a beneficial effect on the eyes. That is because when the child is outdoors and receives adequate amount of sunlight, vitamin D levels rise and the levels of neurotransmitter called dopamine rise, which has a positive effect on the myopia. It has been proven that when children continuously focus on near objects, such as prolonged screen time, prolonged gadget times, and video games, the strain in the focusing muscles has a negative effect on the myopia and can cause a rapid progression. Hence, please teach children to reduce their screen time or to take frequent breaks when screen time is necessary. Encourage children to follow what we call the 20-20-20 rule. Whenever using screens and gadgets, after 20 minutes of screen time, train the child to look away at an object that is at least 20 feet away from them or outside a window, such that the focusing muscles get a chance to relax. These breaks have to be for about 20 seconds after about 20 minutes of near work. Once the myopia has developed, most of the time the myopia continues to progress or increase in magnitude throughout the childhood years up to the late teenage years. Sometimes lifestyle modifications alone are not enough to halt or slow down this progression. At such point, we do need pharmacological measures or some special glasses which help to control the progression. We now use a special form of drops called the atropine drops, which are proven to slow down the progression of myopia by up to 70%. Along with these, we now have what we call the peripheral defocus glasses or the progressive add lenses, which help to control the myopia progression. When a child wears a minus power glasses to see clearly, the central rays of light are brought to focus sharply on the nerve layer, whereas the off-center rays of light are brought to focus behind the nerve layer. This causes a stimulus for the eyeball to elongate rapidly. So now we have specialized glasses which help the off-center rays to be brought to focus slightly ahead of the nerve layer, and it has proven that these design of glasses may help the progression to be slowed down by up to 50%. When the child constantly focuses on a near object, there is a constant strain in the focusing muscles, what we call the ciliary muscles. Helping the child with a small near add segment in the glasses relieves the strain during near work and reduces the stimulus for the elongation of the eyeball. All these modalities may be used alone or in tandem to try and control the myopia to the maximum magnitude. So when a child has myopia, it is a teamwork which generates the best results. The child has to be properly trained and motivated. The parents also have to understand their role in limiting the screen time and encouraging the outdoor play. And the doctor has to step in at the right time with the right modality to try and control the progression. This will ensure that the child continues to have healthy eyes throughout their adulthood. Thank you.